Assalamualaikum and good morning. Forum for today we will discuss related to depression and suicide. Recently, the mass media has often broadcast news of suicides. News like this is heartbreaking, and the question that always plays in the mind is, what prompted the victim to do so? While we don't know the real story behind what bothered their minds to make such a decision, yet in general, many are aware that what is often associated with this incident is depression. So, the brief definition of depression is an emotional disorder that stems from a person's thinking style involving perception of self, life, and environment. With me today are four panelists to discuss the issue of depression. There is Secretaries from Sultan Ismail Hospital, Dr. Siti NAZZIRAH binti ROZUKI, Ustazah IZYAN RASYIQAH binti JAMAL from the Selangor Islamic Religious Department, the sister to an ex-depression patient Miss NURUL ATIKAH binti Muhammad NAZLI, and ex-major depression patient Miss FADHILAH binti Azaman. Firstly, I want to ask Dr. NAZZIRAH, according to doctor, what leads to depression in a person?
Thank you, Ms. Ain. Usually, depression begins in adulthood, but it can also occur at any age, including childhood. Researchers believe that depression can be caused by a combination of genetic, biological, environmental, and psychological factors. These factors include a history of personal or family depression. If a person has a history of depression, he or she is more likely to experience depression again if the situation is not well managed. Even drugs used to treat certain diseases such as diabetes, cancer, heart disease, and Parkinson's disease also push a person toward depression. Furthermore, trauma, stress, or significant changes in a person's life, such as the loss of loved one, may trigger depression because person cannot accept the fact that the loved one is no longer by his side or her side. Next is excessive use of social media, especially if it involves cyberbullying, also a cause of depression. It happens when an individual is mocked by society or when an individual constantly compares himself to the luxury and attractiveness of others, causing him to look down and feel unappreciative of what he has.
The explanation given by doctor is very helpful for us to identify whether we are experiencing depression or are in defined state. To see a clearer example, I invited Miss Fadhilah to share her experience as a former depression patient.
My depressive disorder is mostly caused by my schoolmates. They often bully me no matter what the situation. I was forced to do their homework, buy food, and carry their heavy bag, and many more. To the end, I didn't have time to do all of that for myself. I became exhausted because I didn't have time to rest. I was afraid that if I complained to someone, my friend would abuse me even more. As a result, I was mostly quiet and depressed. Because effect of phobia and pressure, the first sign of change that I noticed in myself were that I became less interested in hanging out and missing out with my friends at school. I always lonely at home, distancing myself from family members, lacking out in communication, and missing the cheerfulness on my face. The condition is worsening, the mind is becoming like sea, and unable to think rationally. I began to despise myself so much, I considered self-harming as a means of suicide.
So, from her experience of dealing with depression, we can see this depressive illness can be very severe if not treated immediately, and the families also an important role in the process of treating this depressive disorder. I would like to congratulate Ms. Fadhilah for successfully overcoming her depression despite taking a long time to recover. Now, we will hear an explanation from the sister to an ex-depression patient, Ms. NURUL ATIKAH, who is going to tell us more about the details on what is she experiencing living with a depression family member and how she finally come to realize there are some signs on depression.
Depression is much more than a bad mood. This makes someone like this who has depressed quite a challenging task. Before my younger sister attempt to commit suicide, To be honest, I could barely notice the sign of symptoms that she depressed because she tried not to show her true feeling. However, I remembered seeing her prefer to stay alone in her room, and she seemed like having a bad appetite as she ate only a little rather than a whole meal. She started to sleep in the late night also. I guess it is because of her suffering from insomnia. I just can't believe my beloved sister dealt with her depression alone without telling anyone of our family members. I thought it was just normal for her being like that because she used to be in this emotional state when she used to have a small problem. She used to tell me that she was tired of studying because she felt like she was left out in her class. Her friends said she was dumb and sometimes being discriminated. One day when I entered her room, I felt so shocked seeing her attempting to commit suicide by taking a lot of sleeping pills. Fortunately, I was fast enough to stop her from taking those pills. After the incident, I had a talk with her. She was being annoyed by being criticized and mocked by her friends. Then I realized I should give her support and affection physically, mentally, and spiritually. Communication is how we should connect as family members. When you live with someone who has depression, it can be painfully difficult and it affects those who love them.
According to Malaysia Youth Council, the Malaysia Psychiatric Association revealed that 90% of attempted suicide cases involving youth and depression are the cause of the increase in suicide cases in Malaysia. In order to maintain well-being and harmony in the family and society, so I would like to address a question to Ustazah IZYAN in relation to what steps can be taken to treat this depression.
Thank you, Ms. Ain. As we all know, Islam teaches that all diseases have cure except death. As a human being, we need to try find the cure or solutions to the disease. Then, we trust in Allah Subhanahu Wa Taala. So, among the steps that can be taken to the depression is the faith community can organize a strong youth program that promote a good communication and social skills. Youth who practice their religious faiths have more positive social values and caring behavior. This can help the youth cope with depression as they get the positive vibes around them. Besides, depressed patients need to diagnose by psychologists. This because of the treatment given are based on the severity, which can choose between psychotherapy or the use of medication. When the patients are taken to the psychotherapy, people around them will know their actual state of health and provide appropriate assistance or support for the recovery process. In addition, as a parents, we have to support our children. In many cases, one of the causes of depression is due to lack of love and attention from their parents. So, when our children suffer from depression, we have to give full attention and always be by their side so that they feel that we are together with them to overcome the depression.
So, from the explanation given by our panel members today, we can conclude that this depressive illness can happen to anyone without realizing it and will get worse if no action is taken immediately. Here, we can also see there are various measures we can take to prevent depression, but in general, spiritual and religious factors are the main factors of depression prevention, with various programs help to increase the positive effects on our souls and selves. I would like to thank all the panel members for coming today to discuss this issue of depression and suicide, and have a nice day ahead.